Imagine you're out with your horse, maybe just after a great ride, and something feels, well, just a little bit off. A subtle shift in how they're acting. Or maybe you run your hand along their neck and notice, a slight warmth. What if that warmth isn't just, from exertion, but something deeper? That seemingly small change can actually be a really critical signal, sort of a whispered message from your horse's body. Welcome to the deep dive. Today, we're taking a really close look into a common but incredibly complex issue in our equine companions, fever. It's so much more than just a high number on the thermometer. It's a vital indicator, a sophisticated communication from your horse that something's happening inside.
Exactly. And our mission today is to take the expert knowledge from some really comprehensive veterinary sources on equine fever and sort of break it all down for you. We're going to explore what fever truly is, the fascinating way it actually works, the surprising range of things that can cause it, because it's definitely not always what you first think, and how vets meticulously diagnose, treat, and even work to prevent it. Hopefully, you'll have some genuine aha moments that leave you feeling, well, truly informed.
Okay, so let's start right at the beginning. When your vet talks about a horse having a fever, what exactly is it? Our sources are really clear on this. Fever, or the medical term pyrexia, isn't just your horse being hot. It's specifically a regulated increase in the body's internal thermostat, its thermal set point.
That's a really crucial distinction, isn't it? It's fundamentally different from, say, hyperthermia. Hyperthermia is an unregulated rise in body temperature, like you see with heat stroke. There, the body's thermostat isn't working right. But with fever, the horse's body is actively working to maintain this new higher temperature. It's a deliberate biological response.
Right. And just to give people some numbers to kind of hang on to, what's normal? Normal rectal temps for an adult horse typically hover between, 99.1 and 100.5 degrees Fahrenheit. That's about 37.3 to 38 Celsius.
That's right. And foals, well, they're like little furnaces. They run a bit warmer, usually 100 to 102 Fahrenheit.
Yeah.
And it's worth remembering these can fluctuate naturally. Lower in the morning, higher in the evening, and definitely after exercise or if they get stressed or excited.
Okay, so the body's deciding to raise the temperature. How does it actually do that? How does it decide to turn up its own thermostat? This is where it gets really intricate, doesn't it?
It really does. It's a complex physiological reaction, kind of like a conversation happening between the body's periphery out where an infection might be and the central nervous system. Basically, what happens is fever gets kicked off by substances we call pyrogens.
Pyrogens, okay? Like
Yeah.
little alarm bells?
Exactly, like alarm bells telling the body something's up.
Yeah.
Some are exogenous pyrogens, meaning they come from outside the body. Think bacterial products like endotoxins or viruses, even fungi. Then there are endogenous pyrogens. These are actually released by the horse's own immune cells, like white blood cells, in response to those outside threats or even just tissue damage. Key players here are molecules with names like interleukin-1, IL-6, tumor necrosis factor alpha, inflammatory messengers.
Okay, so these pyrogens are released. Then what? How does that translate to a higher temperature?
Right. So this is where that internal thermostat located in the brain near the hypothalamus gets involved. It's a specific cluster of neurons there. These endogenous pyrogens travel to this brain region and trigger the production of chemical messengers called prostaglandins, mainly one called prostaglandin E2 or PGE2.
IgG2, got it.
And it's this PGE2 that effectively tells the brain to reset the body's thermostat to a higher temperature. The body then thinks this new higher temperature is its normal.
So it starts working to achieve that new normal.
Precisely. The horse's body goes into action. You might see vasoconstriction, blood vessels in the skin tightening up to reduce heat loss, or shivering and piloerection, that's the hair standing on end, trying to trap air and generate heat.
Goosebumps, basically.
Yeah, like goosebumps in humans, and even behavioral changes like seeking shelter or warmth. It's all aimed at reaching that new, higher set point. And then once those pyrogens are cleared, the thermostat resets back down and the horse will start trying to cool off sweating, vasodilation.
So we've figured out how the body makes a fever. But what's the point? And how does this actually affect the horse? Is it good, bad?
Well, generally speaking, our sources indicate that fever is actually considered a beneficial host defense mechanism. It's part of the fight. Those higher temperatures can actually slow down microbial growth, make it harder for bacteria or viruses to multiply.
Ah, interesting.
Yeah, and it can also enhance immune cell function, make them more effective, and speed up the production of certain proteins called acute phase proteins that are important in fighting inflammation and infection.
So clinically, it's a sign something's happening.
Absolutely. It's nonspecific, it doesn't tell you what the problem is, but it's a crucial sign of inflammation or infection. It tells you the horse's systemic inflammatory response is activated. Now, from a welfare perspective, really high fevers, say over 105 Fahrenheit or 40.5 Celsius, can cause
Like
problems.
what kind of problems?
Well, significant discomfort, obviously, lethargy, they might go off their feed, anorexia, we call it. And in rare cases, extremely high or prolonged fevers could potentially cause organ damage or worsen underlying conditions like triggering laminitis. That's a big concern.
And you mentioned genetics briefly earlier.
Just a quick note, yeah. Some breeds have known genetic predispositions to certain immune-related disorders that can be associated with fever or altered responses. Things like Fanconi syndrome or severe combined immunodeficiency in certain Arabian lines. It's just something vets might consider in specific cases.
Okay, so let's shift gears a bit. We know what fever is, how it works, but what causes it? You said it's not always obvious.
Not at all. And this is absolutely critical. Fever is a symptom, not the disease itself. It's like a warning light on your car's dashboard.
Right, it tells you there's a problem, but not necessarily which problem.
Exactly. Finding the underlying cause is paramount. And what's really fascinating is just the sheer variety of potential causes. It can be quite the diagnostic puzzle. Generally, causes fall into two main buckets, infectious or non-infectious, and the sources are clear. Infectious causes are definitely the most common in horses.
Okay, let's break down the infectious ones first. Bacteria seem like a big category.
Huge, and they can affect almost any system. Respiratory infections are common, things like strangles caused by Streptococcus equi or bacterial pneumonia in foals. Rhodococcus equi is a major concern, and shipping fever, which is pleural pneumonia, often seen after transport.
What about gut issues?
Yes, gastrointestinal infections are definitely up there. Colitis, which is inflammation of the colon caused by bacteria like Salmonella or Clostridium difficile. Potomac horse fever is another one caused by Rickettsia rhizticii. And then you can have infections within the abdomen itself, like peritonitis or abscesses.
Wow, okay. What else for bacteria?
Oh, the list goes on. Musculoskeletal system, you can get cellulitis, which is a skin infection, or deeper abscesses. Septic arthritis, an infection in a joint, or osteomyelitis, which is a bone infection. Then there are urinary tract infections, reproductive tract infections in mares like metritis or placentitis, umbilical infections in newborn foals. Even dental or sinus infections can cause a fever.
That's a lot just for bacteria. What about viruses?
Viruses are also major players. Equine herpes virus, especially EHV1 and EHV4, are really significant. They cause respiratory disease known as rhinopneumonitis, but also abortion in mares or even severe neurological disease. Equine influenza virus is another common culprit for respiratory illness and fever. Equine viral arteritis, or EVA, too.
And there's some more serious ones, right? Neurological ones.
Yes, definitely. West Nile virus, or WNV. And the encephalomyelitis virus is Eastern, Western, and Venezuelan equine encephalomyelitis, often called EWVV. These typically cause neurological signs along with fever. And then there's African horse sickness, which is thankfully exotic to many areas, but is highly fatal where it occurs.
Okay, bacteria, viruses.
Yeah.
Any other infectious agents?
Yep. We also need to consider fungi, things like guttural pouch mycosis affecting part of the airway, or aspergillosis. And protozoa. Equine protozoal myeloencephalitis, EPM, can sometimes present with a mild fever initially. And then there are tick-borne diseases like pyroplasmosis or babesiosis, which cause fever and destruction of red blood cells.
Phew, that's a huge range of infections. But you mentioned non-infectious causes too. That seems counterintuitive for fever.
It does, but it's really important to remember sometimes the body's inflammatory response gets triggered without an actual bug involved. For example, immune-mediated diseases. This is where the horse's own immune system kind of goes haywire and attacks its own tissues. Immune-mediated hemolytic anemia, or IMHA, where it attacks red blood cells, can cause fever. Systemic lupus is another, though it's rare in horses.
What about just general inflammation?
Absolutely. Some types of non-infectious colic can involve significant inflammation and sometimes a low-grade fever. Acute severe laminitis can sometimes be associated with fever. Major trauma, like severe burns, certainly triggers a massive inflammatory response and fever. Even mild temporary fevers can happen after vaccinations or surgery. That's just the immune system reacting as expected.
Interesting. Anything else non-infectious?
Yes, neoplasia, which means cancer. Some types of cancer, like lymphomas, can cause what's called paraneoplastic fever. Less commonly, you might see weird idiosyncratic drug reactions causing fever, or reactions to certain toxins, things like fescue grass toxicity, blister beetle poisoning, even snake bites. And then there's this specific diagnosis called fever of unknown origin, or FUO.
FUO. What's that?
That's basically when a horse has a persistent fever, usually defined as lasting at least 3 weeks, and despite a really thorough diagnostic workup, the vet just can't pinpoint the cause. Interestingly, a lot of these FUO cases actually resolve on their own, or maybe it was a low-grade infection that just wasn't detectable and eventually cleared up. But it's a recognized diagnostic challenge.
Okay, this huge list of potential causes really highlights the next big question.
Yeah.
How on earth do vets figure out which one it is? How do they pinpoint the source?
It really comes down to a systematic approach. It's like detective work, starting broad and then narrowing down the possibilities based on clues. And the first, absolutely crucial step is getting a comprehensive history from the owner.
What kind of details are they looking for?
Everything, really. How long has the fever been going on? What's the pattern? Does it spike at certain times? What other signs have you noticed? Coughing, nasal discharge, diarrhea, any lameness, neurological signs like stumbling. They'll ask about recent travel, vaccination status, deworming history, exposure to other horses, especially sick ones, diet, water source, environment. Even a mare's pregnancy status is vital. Every little detail can be a potential clue.
Makes sense. Then comes a hands-on part, right? The physical exam.
Exactly. A complete, thorough physical exam is essential. Of course, that includes taking the rectal temperature, often repeatedly to track it, checking all the vital signs, heart rate, respiratory rate, careful listening, auscultation of the lungs, the heart, the gut sounds, feeling, palpating the lymph nodes, joints, tendons, muscles, a rectal exam to assess abdominal organs internally, and a really good look at the eyes, nose, mouth, feet, and checking for any wounds or swelling anywhere on the body. It has to be head to tail.
Okay, history and physical exam give some initial ideas. What's next? Blood tests.
Usually, yes. Initial diagnostic tests, what we might call Tier 1 tests, often start with blood work. A complete blood count, or CBC, is incredibly informative. It looks at red and white blood cells, changes in white cells like high counts, leukocytosis, or low counts, leukopenia, or an increase in immature neutrophils called a left shift strongly suggest infection or inflammation. We can also see toxic changes in neutrophils indicating severe inflammation. And checking for anemia, low red blood cells is important too.
What about the other blood panel, the chemistry?
Right, the serum biochemistry profile. This gives us information on organ function and other markers. Key things we look for with fever include acute phase proteins. Fibrinogen is one if it's significantly elevated, say over 400 milli-GDL. That points towards significant inflammation, often chronic. Serum amyloid A, or SAA, is another one. It's actually more sensitive and reacts much faster to acute inflammation, so it's becoming a really valuable tool. The profile also checks liver and kidney enzymes, electrolytes, gives a broader picture of the horse's systemic health.
And you mentioned urinalysis as well.
Yes, a urinalysis can be very helpful too. Looking at the urine concentration, checking for protein, blood, signs of infection, or even myoglobin, which indicates muscle damage, it adds another piece to the puzzle.
Okay, so those are the initial steps. But what if those don't give a clear answer? What are the more targeted tests, the Tier 2 things?
This is where it gets really interesting because the vet uses the clues from the history, exam, and initial tests to decide where to look next, focusing on specific body systems. So if respiratory signs are prominent, they might recommend endoscopy using a small camera to look directly into the nasal passages, the guttural pouches, the trachea.
To see what's going on inside.
Exactly. They might also collect samples directly from the lower airways using a tracheal wash, TW, or bronchoalveolar lavage, BAL. Those samples can then be examined under a microscope that's cytology and cultured to identify specific bacteria. Chest x-rays or ultrasound might be needed to look for pneumonia or abscesses deeper in the lungs.
And if it looks like a gut problem?
If GI issues are suspected, beyond the rectal exam, they might perform an abdominocentesis. That's carefully inserting a needle into the abdomen to collect fluid. Analyzing that fluid can diagnose peritonitis, an infection in the abdominal cavity. Fecal cultures are used to look for specific bacteria like Salmonella or C. diff, and there are specific PCR tests for things like Potomac horse fever.
What about lameness or swelling? Musculoskeletal issues?
If a joint is swollen and painful, a joint fluid analysis is key. They'll collect a sample of the synovial fluid to check for signs of infection, high white cell counts, bacteria, and culture it. That's crucial for septic arthritis. Radiography or ultrasound can help diagnose bone infections, osteomyelitis, and blood tests for muscle enzymes like CK and AST can point towards muscle damage or disease like rhabdomyolysis.
In neurological signs.
If there are neurological signs, analyzing the cerebrospinal fluid, the CSF, is often necessary. That involves a careful spinal tap. Blood tests, serology, can look for antibodies to viruses like West Nile, EHV1, EWV, or for exposure to the protozoa causing EPM.
Are there other key tests depending on the situation?
Definitely. A blood culture might be done if septicemia bacteria circulating in the bloodstream is suspected. If there's an obvious wound or abscess, culturing that material is vital to identify the bacteria and determine the best antibiotics. That's the sensitivity part. And depending on the region and clinical signs, specific tests for tick-borne diseases might be run.
What about that fever of unknown origin, the FUO cases? How do they approach those?
With FUO, it often requires a really persistent, systematic reevaluation. Going back over the history, repeating exams, looking for really subtle clues that might have been missed. It often involves serial blood work, maybe repeating imaging, considering rarer causes. It's a process of elimination and careful observation, hoping to find that hidden answer. Or sometimes, as we said, the fever just resolves without a definitive diagnosis.
Okay, so once a cause is found, or at least strongly suspected, what's the approach to treatment? Bringing down the heat seems like a priority.
It's usually part of the plan, yes. The main treatment goals, according to our sources, are really threefold. 1, reduce the fever, primarily for the horse's comfort, that's antipyresis. 2, provide supportive care to help the horse cope and recover. And 3, most importantly, treat the specific underlying cause.
Let's talk about reducing the fever first. What are the main tools for that?
The workhorses here are the nonsteroidal anti-inflammatory drugs, NSAIDs. Most horse owners are familiar with flunixin meglumine, brand name Banamine usually, and phenylbutazone, or Bute. Furocoxib, brand name Equiox, is another option. It's a bit more selective in how it works. These drugs are very effective at reducing fever and inflammation.
But they have downsides, right? You have to be careful.
Absolutely crucial. NSAIDs come with significant potential side effects, especially with prolonged use or in certain situations. They can cause kidney damage, nephrotoxicity. They're known to increase the risk of right dorsal colitis, a serious condition affecting the colon, and also gastric ulcers. These risks are higher in horses that are dehydrated or if they're receiving other drugs that can also affect the kidneys. So vets use them carefully at appropriate doses and durations.
Are there other ways to cool a horse down besides drugs?
Yes, external cooling methods can be used, especially if the fever is very high or if NSAIDs aren't appropriate for some reason. Things like hosing the horse down with cool water, not ice cold though, as that can cause vasoconstriction and actually trap heat internally. Using fans to increase air circulation can also help significantly.
Is there any debate about whether cooling is always the right thing to do?
There is, actually. It's an ongoing discussion, maybe more prominent in human medicine, but relevant here too. Is actively treating the fever always beneficial? We talked about fever being a defense mechanism, right? It can enhance immune function, inhibit some microbes. Some studies, particularly in severe infections, have even suggested that letting the fever run its course might sometimes be linked to better outcomes, believe it or not.
That's really interesting. So why do we usually treat it then?
Well, the flip side is that higher prolonged fever definitely has detrimental effects. It increases the body's metabolic rate, which burns energy and can lead to muscle breakdown and weakness. That's catabolism. It causes lethargy, anorexia, discomfort. Very high fevers, like over 108 Fahrenheit, can potentially cause seizures or even cardiovascular collapse. So it's really a balancing act. Often, NSAIDs are given as much for pain relief and reducing inflammation as they are for lowering the temperature itself, and those effects are hard to separate. We want the horse to feel better, so it might start eating and drinking again.
Right, makes sense. So managing the fever is one part, but the core is treating the underlying cause.
Absolutely the most critical part. If it's a bacterial infection, that means antibiotics. Ideally, the choice is guided by culture and sensitivity results, showing which bacteria are present and which drugs will kill them. Often, vets might start with broad-spectrum antibiotics while waiting for those results. And for things like abscesses or septic joints, surgical drainage or flushing might be essential alongside the antibiotics.
What about for viruses?
Viral infections are trickier. There are very few effective antiviral drugs available for horses. Maybe acyclovir or valacyclovir are sometimes used for severe EHV1 neurological cases, but efficacy is debated. So for most viral infections, treatment is primarily supportive care, helping the horse's own immune system fight it off.
And for those other causes,
Yeah.
protozoa, fungi, non-infectious things.
Specific treatments exist for those. Protozoal infections like EPM are treated with antiprotozoal drugs, like ponazuril. Fungal infections require specific antifungal medications. For non-infectious inflammatory conditions, like immune-mediated diseases, corticosteroids might be used to suppress the immune system, but very carefully, as they can mask underlying infections or worsen laminitis. Treatment is really tailored to the specific diagnosis.
And you mentioned supportive care as the third pillar. What does that involve?
Supportive care is absolutely vital for recovery, regardless of the cause. It's about keeping the horse comfortable and helping its body heal. This includes rest, sometimes stretch stall rest, ensuring they stay hydrated, providing fresh water, maybe electrolytes, or even intravenous fluids if they're not drinking enough or are dehydrated. Nutritional support is key if they're off their feed, offering palatable mashes or feeds, sometimes needing more intensive support. And diligent monitoring is crucial.
Monitoring what specifically?
Watching their temperature, heart rate, respiratory rate, checking their appetite, water intake, urination, defecation, assessing their comfort level, looking for signs of pain, and being vigilant for potential complications, especially laminitis, which is always a risk in sick horses.
So with all this complexity, what's the general outlook? What's the prognosis when a horse gets a fever?
It's incredibly variable. It completely depends on the underlying cause, how severe it is, how quickly it's diagnosed and treated, and the horse's overall health. The prognosis can range from excellent for maybe a mild, self-limiting viral infection that clears up in a few days, all the way to guarded or poor for severe systemic infections like septicemia, or if serious complications like laminitis, severe pneumonia, or organ failure develop.
Which really underscores the importance of prevention, doesn't it?
Yeah, absolutely. Prevention is always better than cure. And there are several key strategies our sources emphasize. First and foremost is vaccination. Keeping up with a veterinarian recommended vaccination schedule is vital for diseases like equine herpes virus, influenza, West Nile virus, strangles, and others relevant to your area and the horse's lifestyle. What else? Biosecurity. Biosecurity is huge. Implementing strict protocols for any new horses coming onto a property quarantine periods are essential. Being careful at shows and events, avoiding shared water sources or equipment, and having clear procedures for isolating and handling any sick animals to prevent spread.
And managing the environment.
Yes, vector control is important for diseases spread by insects, like managing mosquitoes to reduce West Nile virus risk, or ticks for diseases like pyroplasmosis or Lyme. Good stable hygiene, reducing dust, providing clean, fresh water, and minimizing stress are all part of environmental management. And just good general husbandry, optimal nutrition, regular dental care, appropriate parasite control all contribute to a strong immune system that's better equipped to fight off challenges.
And finally, just being observant as an owner.
That's a massive part of it. Early detection makes a huge difference. Empowering owners like you to be vigilant, maybe even comfortable taking a horse's temperature regularly and noticing those subtle early signs of illness. That slight change in demeanor, that warmth you felt at the beginning, recognizing those things quickly allows for prompt veterinary attention, which can significantly impact the outcome.
So wrapping this all up, what's the big takeaway for our listeners?
I think the main thing is that a fever in your horse, it isn't just a number on a thermometer. It's really a profound, complex signal from this magnificent animal's body indicating a battle is going on within. Understanding this whole intricate process, from the tiniest pyrogen molecule setting off an alarm all the way through the comprehensive diagnostic journey and treatment options, it really deepens our appreciation. Appreciation for both the horse's incredible resilience and also the dedication and tools of veterinary science.
It makes you think, doesn't it? What other seemingly simple signs in our world, maybe things we see every day, hold such deep hidden complexities once you actually start to unpack them? Keep exploring, keep learning, and keep diving deep.